This is the podcast overview for the learning objectives that go along with Chapter 14, Psychological Disorders. So we'll start the chapter by explaining how our definition of abnormal behavior and thinking has changed over time, how we have come to understand what is abnormal behavior, what classifies a behavior as abnormal according to our current standards. And then we'll take a look at the different models used to explain psychological disorders. So there are different sort of schools of thought that help us understand our own psychology and make sense of something that is disordered thinking. So not one of these models is the true sort of answer to psychological disorder. They are just different ways of explaining what psychological disorder is. Think of it as a different lens through which we might look at each disorder. We'll then begin to describe how psychological disorders are diagnosed and classified according to the DSM 4 revised edition, which is a publication of the American Psychological Association, and it's used to basically catalog all of the disorders of the psyche and how we diagnose them and how we classify them. And then once we have that grounding and that understanding, we'll then start to dive into looking at different disorders of mood. So this is the first major category of psychological disorder, mood disorders, which includes major depressive disorders and bipolar disorders. We'll compare and contrast the different explanations for depression or other disorders of mood. Next, we'll move on to anxiety disorders, looking at what their symptoms are and the various types of anxiety disorders. Specifically, we'll look more at obsessive compulsive disorder, or OCD, and stress-related disorders like PTSD. We'll look at the different potential causes of anxiety, of trauma, and stress disorders. Then we'll move into looking at dissociative disorders, which include dissociative amnesia, dissociative fugue, and dissociative identity disorder. These are sort of breaks in one's reality from their understanding of who they are, where a person gets confused about who they actually are. And or could create different identities for themselves. And then we'll look at some explanations as to how we can understand dissociative disorders. We'll look very briefly at some of the symptoms and risk factors associated with anorexia nervosa and bulimia nervosa, as well as binge eating disorder. And then two different types of sexual dysfunction, with explanation of how those may develop. And those are very just kind of brief look at each of those. We'll then wrap up with talking about two more classes of disorders, one being personality disorders. There are varying types of personality disorders, so we'll look at all of those different classifications. And again, we're just skimming the surface. We're not getting super detailed here. And then different potential causes of personality disorders. And anytime we talk about causes of anything, whether it be anxiety or depression or personality disorder, I want to remind you that we're always going about that identification through different lenses of thought. So that's where we go right back up to the beginning, where we looked at potential explanations for psychological disorders and how we go about classifying them and in diagnosing them. It really depends on your view of psychology, and that can differ We think of people like Freud and psychoanalytic theory, or we think of cognitive behavioral theory or humanistic theory. All of those theories guide how a therapist or a psychologist might approach a client, might approach a person who has a particular disorder. And so it's important to understand those different lenses and how they view disordered behavior. And that's where you'll start to understand next chapter treatment, because the treatment that a psychologist prescribes for a patient is going to depend on perhaps maybe where they think that person's disorder came from or contributing factors to it. So personality disorders, causes, types, looking at some specifics between the positive and negative symptoms that come with schizophrenia would be next in line. So, personality disorders and then schizophrenia, whereas, the person's having a break in reality, kind of a break from what is real. And that can happen in both what they call positive and negative ways that it's adding something to your mind, what your mind is doing, or taking away from, limiting what your mind is capable of. We'll evaluate the biological and environmental influences of schizophrenia, which are pretty large, and you'll notice that this is one of the disorders that we have, I wouldn't say the most, but we have a great deal of evidence for its biological component, but there are still very many environmental factors that can trigger that biological component. And lastly, something that's totally applicable to all of you, identifying some ways to overcome test anxiety, right? That's a situational anxiety. We don't think of it as a psychological disorder, but nonetheless, it is something that affects probably everyone at some point in time, and just some ways to combat that. And that will wrap up Chapter 14, Psychological Disorders.